Hello, welcome to What Can Meaningful Use Mean for You? My name is Lisa Smith and I'll be your presenter for this webinar. This is a very exciting time in healthcare, so I hope that you're all going to sit tight and listen closely and get the most out of this information, because truly meaningful use is meaningful for you. Okay, so let's get on to the basics. The HITECH Act was signed into effect in 2009 by President Barack Obama. It allows for $19.5 billion worth of allocations for incentive dollars for those providers who choose to convert to EHR during a set period of years. Now, there are two programs that are providing these dollar amounts, and they are Medicare and Medicaid. And in order to qualify under either program, a provider must meet our topic for today, what is called meaningful use. So what is meaningful use? That's what we are going to be going into today. But first, we have to remember that the payments began in 2011, so a lot of providers are already up on the curve and receiving their meaningful use payments, and it's been so far a very successful program, and we're very happy to have seen that level of success. These payments under the Medicaid program will extend through 2021. So that is a very generous allotment of time for Medicaid providers to be able to qualify and get up and running with their electronic health records. Medicare, not so much. We will see fee reductions on your schedule of payments starting to hit in the year 2015. So what that means is if you have not complied with meaningful use under the Medicare program, you will start to see deductions in the amount of money you make for Medicare on each of your visits. So we really want to watch that. The reductions are going to start out at about 1% and are projected to go as high as 5% over a few years. However, we're hoping that that's not going to be the case. We really feel like most providers are going to go ahead and convert to EHR, and this is not going to be an issue. But those reductions are in place just in case. Now, Medicare providers have to qualify by 2014 in order to avoid these 2015 reductions. So that's very important. This is 2012. We don't have that much time left. So we really want to make sure that we stress the importance of providers who are participating in the Medicare program jumping on board so that these issues are not hitting you in the face all of the sudden in 2014 and 15. But the first thing you have to know is you have to be eligible to benefit from this. So as a provider, are you eligible? And that's what we're going to talk about next for a few minutes. Okay, so the big question, how do I know if I'm eligible? Well, it's very simple. CMS has given us this cute little flow chart that we can work from. And basically you ask yourself a series of questions. For instance, did you perform 90% of your services in an inpatient hospital or emergency room hospital setting? If you say yes to that question, then forget it. You're not eligible. It stops you in your tracks. However, if you say no, it'll go on to ask you the question, were at least 30% of your services furnished to Medicaid patients in an outpatient setting, or 20% for pediatricians? If you say yes, you can go down and it asks you, are you one of the following types of providers? If you say yes, then it tells you where you are as far as adopting meaningful use and receiving your incentive payments. However, if you're not furnishing most of your care of this nature to Medicaid patients, then you would say no, and you would go on to answer the question, did you practice predominantly in an FQHC or RHC with a 30% needy individual patient volume threshold? Again, if you say yes, you follow the Medicaid path, and if you say no, it would move you over to asking if you treat Medicare patients. If you say no, then you're not eligible. If you say yes, then it'll ask you what type of provider are you, and then it will take you down and tell you that if you successfully demonstrate meaningful use, you may be eligible to receive incentive payments under the Medicare program. This is very simple and a nice little flow chart so that providers can really see if they are eligible. Bottom line, if you participate in Medicare or Medicaid, you're probably eligible unless you are predominantly a hospital doc. So just have to keep that in mind. That is the one exclusion there. But other than that, it's very simple to know whether or not you are an eligible provider.